This is a new thing we're sending out to our referrals to scan. So traditionally what we've done is use the traditional scan body by MegaGen, the tall scan bodies, which look like this. There were two different sizes. There was a 13 millimeter and a 9 millimeter, this being the 13 millimeter. And that's traditionally what you see in a scan body scan. And in those, you would remove the healing abutment, place the scan body, scan the tissues. But there's this new scan post or scan healing abutment that we're introducing to all of our referrals that's made by MegaGen. But essentially what it is, you'll see the patient and it'll present to you with healing abutments like they normally are with healing abutments. However, these have a dedicated snap caps that look like little white peaks, and we'll give these to all of our referrals, and they index, see this flat index here? It actually indexes onto these healing abutments only one way. So there's a flat side here that would line up with the flat side of this, and on the back one you see how this has a flat side? Well, that's where this flat side would go, right? So these snap in a very precise location. This number 5 has no significant information. That's just that diameter of this, but really all the lab needs to know is the height of these. They can mostly tell by the color of them. There's two different colors. There's the gray, which is with a 5 millimeter height, and there's the green, which is the 7 millimeter height. So you get your patient in, they look just like this. You'll scan their lower arch with these scan bodies in place. You do not have to remove them. We actually encourage you not to remove them. And just place these snaps on and then scan these as they are. And that's it, you're done. You'll take those out. You'll scan the opposing arch, and then you'll take your occlusion scan and you'll send this to your lab of choice. And after that, you're done. So that's your whole workflow for making a custom abutment and a final crown restoration or a provisional crown or whatever you want to do. The lab has enough data with this information to go ahead and move to finals. So if you look at this little worksheet that we have, it's just like a step-by-step to scan this. Just give this to your staff so they're aware of what's going on. There are a few things to look out for if you choose to take an x-ray, which you're not obligated to because we'll take the x-rays in our office. You need to make sure that the scan healing, the metal post that we deliver is fully seated. If it's off at all, that means your final crown is going to be off. So if this is ever loose in the patient's mouth, which typically they won't be ever loose, but if they are loose, then yes, they need to be tightened down fully before you snap on this white little cap. So the white cap snaps onto this metal healing abutment that's actually also acts like a scan body. There's going to be two different sizes. There's going to be the 5 length and the 7 millimeter length. Either one of those lengths, just kind of depending on the tissue height. It's just a closer up view of those two heights, the 5 and the 7. 5 being the gray, 7 being the height. And then from there, the lab will choose the correct scan body custom abutment profile for the area that you want. Now, another thing to note, scan errors. So if you see here the tissue scan looks great, everything looks great, but you see there's a double scan of the scan body. See how this one looks small and this one looks really large? That's a double scan. So that's not going to be accurate at all. So just make sure your staff is aware of that. This is what we'll be including with all of our referrals whenever you're making the custom abutments and the final crowns. We'll also help fill out the lab script for these patients, and we'll give you the white cap peaks that go onto the patients, these little white caps, so you won't have to order those. Depending on the core diameter of the implant, we're going to recommend whether you use a 3.3, 3.3 extra easy, the 4 core, or the 4.8 core. We'll recommend that based on the implant we place, and we'll also include the sticker so that you know whenever you restore the implant what's going to be the appropriate size. We hope this works out for all of our referrals. And call us if you have any questions. We'll also have a QR code here with a link to this video that you can use to watch and train your